So, the stakeholders and force field analysis. The stakeholders, or the patients that I identify in this case study were the patients, management, and the frontline staff, the nurses and the CNAs, also the unit clerks or unit secretaries are all key players and that are involved. One of the helpful forces was, of course, the fall risk. I can't stress that enough. These tools are put in place for the advantage of the staff and the hospital and the liability of the hospital and nurses and patients as well. Accurate documentation of the assessment of the fall risk scores. Effective communication, handoff, SBAR report, mentioning the and documenting of the fall risk assessment were some of the helpful forces, and some of the hindering forces are lack of communication, lack of managerial support and accountability, lack of education regarding these fall risk assessments were also something that in all the studies there was a lack of communicating from nurse to nurse if it was done, or in some of the studies it wasn't even mentioned that if it was done or not, and it wasn't followed up on. So for management to go back and maybe do chart audits or audit certain or all of the assessments, the fall risk assessments on all new admissions was one of the things that I mentioned that could be possibly be done and help in decreasing the fall risk, because falls happen in all sectors, in nursing homes, hospitals, in patients' home, and it is one of the leading causes of injury and sometimes often death in the elderly. And once again, like I said, it's not always the elderly, or just because they're elderly that they are at a higher incident of falling. People that have back surgeries or knee surgeries or hip replacements that are young also can fall because of the mobility aid. So it's not just elderly patients that fall, but they are at the highest risk of having falls in the hospitals. And also looking at the medications that these patients, especially the elderly, are taking is extremely important. We know that their kidney function is not always at a rate where it's excreting out all these medications that they're taking, and most elderly patients are on multiple drugs. So it's important, and that goes back to utilizing the fall risk assessment, because in that assessment, one of the questions or one of the grading criteria is if the patient is on multiple drugs, and they get various points for opioids and psychotropics and antihypertensives and anti-diabetic medications, because these medications are known to cause equilibrium issues. So utilizing the fall risk assessment tool is extremely important, and the increase in educating nurses and staff on utilizing those is key.